Taking care of our skin is important to many of us, and it's especially important to protect our skin from the intense Arizona sun. Joining me now is dermatologist Dr. Jennifer Linder to teach us just how important sunscreen is when it comes to protecting our skin. Good morning, it's good to see you.
Good morning, nice to see you too.
In the interest of full disclosure to our audience today, as soon as you walked in the building, I said, come here, I need to show you my hands. And oddly enough, it's exactly what you're talking about today. We're going to be talking a little bit about hyperpigmentation.
Exactly. So hyperpigmentation can be triggered by three different things. One is sun exposure, so it happens a lot here in Arizona. One is trauma, and one is hormone induced. In your situation, what happened is you scratch your hand, the back of it a little bit.
Something happened.
And then got sun exposure on it. And that can actually trigger what's called post-inflammatory hyperpigmentation. Basically, irritation combined with sun exposure makes brown spots. Can you guys see the difference how the one side is a little bit darker than the other?
Little dots all over it.
And so the same thing can happen in your face after acne, like the little acne breakouts can cause that, or scratches or anything. And then people also get pigmentation from hormones, something called melasma, which can happen either from taking birth control pills.
I've heard a lot of people during pregnancy have those melasma issues.
Exactly. So, and I was pregnant last year, had a little bit of brown spots from that, and luckily we treat it all the same way.
Okay. Thank goodness for me. So let's talk a little bit about melasma, and particularly it affects those people that are pregnant and post-pregnancy, but it kind of sounds like it's a hormonal issue as well.
Right, so it can happen to women or even sometimes men, just sort of out of the blue, but more frequently it happens because of birth control pills or pregnancy, and it ends up looking like, we call it the mask of pregnancy, because it ends up looking like little sometimes spots on the cheeks, spots on the forehead, or like a little mustache, actually.
I want to take a look at some before and after pictures, because a lot of the issues that people that are watching today perhaps will be dealing with would be, say, due to sun exposure or from just aging.
Exactly. So this is a young woman who actually had a little bit of the hormone induced, but most of hers was actually freckles from growing up here in Arizona. She was a patient of mine. You can see she has freckles all over her face. And what we did with her is we did 2 peels, and then we started her on a brand new product that just came out in the last couple of months called Intensive Clarity Treatment. And it's a retinol product that also has some lightening ingredients in it, and it's truly revolutionary.
So can anybody use that?
Anybody can use this.
So even if you don't have the hyperpigmentation, does it just smooth out the surface of the skin?
It does, because it's got retinol in it. Retinol is a vitamin A product that helps with fine lines and wrinkles. It helps trigger new collagen, and the nice thing is it also helps to lift pigmentation. But what makes Intensive Clarity Treatment so special is that it's additional products in it that help to lighten the skin. So you have all these things working synergistically together to make the skin lighter, brighter, and younger looking.
Wow, okay. So photoaging, what does that look like, and can you reverse that?
Right, so photoaging is sun-induced aging. So probably 90% of aging is due to sun exposure. So again, something that we all kind of want to worry about. This is a woman who had, you can see all the fine lines and wrinkles around her eyes, but also notice that black spot underneath the one eye, and that was a sunspot. And so using, again, intensive, this was called intensive age refining, helped make the fine lines and wrinkles go away, and look how much it lightened that brown spot. And she also had 3 Sensi peels. So chemical peels are really nice to do in addition to really lift the pigmentation.
A lot of people say, oh, I've done peels at home. And I bet you hear that when you have patients come into your office as well. But there's a defining kind of line between what you can provide or a dermatologist could provide and what we can get over the counter.
Right, so the over-the-counter stuff just simply usually is not enough, or it's not focused enough to get the right thing. You really want to go to someone who, like, I always recommend going to someone who's PCA certified to get it done. They're educated, they know the right peels, and they can also help you decide the right product to get your skin back to where you want it to be, whether or not you're working on aging or pigmentation, and you'll get a much better result if you go to someone who's certified.
Is it my imagination, or do we in Arizona tend to have, like, let's say you get a blemish on your skin and you know, it doesn't completely go away. Is it my imagination, or do you sometimes get like dark spots that result from that? Or the same if you scratch yourself and then you get like a scar, and then that scar gets darker?
That's exactly. So we think of them as being scars. Luckily they're not scars because we can make them better, but that's exactly what happened with your hands, or what happened to people on their faces, and it's basically a combination of sun and trauma, and you get a brown spot. So doing something like the Intensive Clarity and using it every day at nighttime will lift it, and it'll get better day by day by day, and your skin will look better and more youthful overall.
I'm noticing that spot on the before picture right to the, well, her eyebrows are kind of thin, but to the right of it.
Yeah, exactly. And this patient, again, used this every night, the Intensive Clarity, and it lifted over time. We did 1 peel with her.
So we have to be committed to the treatment for a period of time,
you're
whether
doing
it's 2 months or 5 months
right.
or whatever.
You just do a little bit every day, and it gets better over time. And then you also want to make sure that you're wearing your sunscreen, because you don't want it to come back.
Okay. Sunscreen on my hands.
Sunscreen on your hands. Try it. It will work. I promise you.
I told my mother, I said, is it possible that I'm not quite 40, but I already have age spots? She goes, I don't know. And I'm like, let me go ask somebody else. That was not the answer I was looking for.
Luckily, it works on age spots, too.
Oh, good, good. Good to know. Thank you so much for coming in.
My pleasure.
It's always nice to talk with you and learn a little bit more information. If you would like a little bit more specifically catered to you and your skin issues, you can get in touch with Dr. Linder. We're going to provide that information on SonoranLiving.com.